Tropical diseases. Diseases such as cholera, hepatitis A, and typhoid are food or waterborne. Dysentery is associated with contaminated water, whilst tetanus is a bacteria in the form of spores via a puncture in the skin. Malaria and dengue are both spread by mosquitoes. Cholera is a bacterial infection. It is caused by drinking water that is contaminated with Vibrio cholerae bacteria or by eating food that has been in contact with contaminated water. Many people who are infected with cholera bacteria do not develop any symptoms. However, cholera can cause severe watery diarrhea, nausea, vomiting, and muscle cramps. Without prompt treatment, about half of people with the most severe symptoms will die within a few hours, usually due to a combination of dehydration and shock. If cholera is promptly treated with a combination of antibiotics, fluids, and oral rehydration solution, the outlook is much better. In this case, only 1% of people will die from the disease. Malaria is a serious tropical disease spread by mosquitoes. If malaria is not diagnosed and treated promptly, it can be fatal. A single mosquito bite is all it takes for someone to become infected. Symptoms of malaria. It is important to be aware of the symptoms of malaria if you are traveling to areas where there is a high malaria risk. Symptoms include a high temperature of 38 degrees centigrade or above, vomiting, sweats and chills, muscle pains, headaches, and diarrhea. Malaria is caused by a type of parasite known as Plasmodium. There are many different types of Plasmodium parasites, but only 5 cause malaria in humans. The Plasmodium parasite is mainly spread by female Anopheles mosquitoes, which are night-biting mosquitoes. When an infected mosquito bites, it injects the parasites into your body. Dengue is a common viral infection spread by mosquitoes. It is widespread in tropical and subtropical regions. Symptoms of dengue include a high temperature that can reach as high as 41 degrees Celsius, headache, pain behind the eyes, bone, muscle, and joint pain. Dengue is spread by a type of infected mosquito called the Aedes aegypti mosquito. An infected human is bitten by a mosquito, the infected mosquito then bites another human, and the cycle continues. The condition is widespread in areas of the world with a high mosquito population, typically areas that have a combination of a warm and humid climate, as well as overcrowding and major urban centres. The mosquitoes that spread dengue are rare in England, and cases that develop in the UK occur in travellers who picked up the infection overseas. Dengue cannot be spread from person to person.